All right, everyone, welcome back to ICU. Today, I have a fellow IC warrior here with me. Her name is Renata. Welcome, Renata.
Thank you so much. Thanks for having me.
Yes, super excited to have you on and to dive into your IC journey so far. And a little background for the listeners. I just I feel like I knew this before, but today I realized we live in the same area of Pennsylvania.
Yes,
Like probably 10 minutes away from one another. So this is
I know.
really fun to do. I love connecting with people who are local to me. And I just think it's awesome, like what the internet can do for us, you know?
It is. It really is.
Yeah, yeah. So, okay, why don't you tell the listeners, a little bit about yourself and then more about your IC journey so far?
Great. Sounds good. So I am 35. I'm a medical social worker. Let's see. I've been living with IC for about, I would say, unofficially, probably 10 plus years, but I was diagnosed about, I guess, like 7 years ago. So, just a little bit of background quickly. I was a soccer player growing up. I started playing when I was 5, big athlete. I played through college, had multiple injuries, surgeries. I had meniscus repair twice. I had ACL, the usual stuff. So, kind of have a little bit of some injuries in my background. And everything was kind of going well physically. And I guess I ended up having, I was diagnosed with PCOS, and that kind of was what triggered a few other things to happen. So I was diagnosed with PCOS in 2013. I had pretty horrific periods my entire life. Even my first period, it was pretty painful. And I used to skip quite a bit because of the whole athlete, amenorrhea, I guess it's called.
Isn't that related to like the female athlete triad, or is that something different?
I think you're right.
If you're like somewhat underweight too.
Yes. I've always been pretty underweight, thin, very athletic. I like lived and breathed soccer. That's like basically all I did.
Oh my God, that was my life growing up too. So I get
Oh,
it.
really?
It's intense, like doing club, travel, whatever.
Exactly.
Yeah, it's
Exactly.
intense.
It really is. And, you're not really thinking about the fact that you're having all this pain and, you're having these bad periods. And, even in high school, I remember having to take medicine for it. And, I think that was, back in like the early 2000s, that, doctors kind of shrugged it off. They were just like, oh, you're just, you have bad periods. No one in my family had that. It was just kind of me. So, I don't have any sisters. So I guess I was just like, all right, I just have to fight through this. So then I was in grad school to become a social worker, high stress. I was working part-time. I had my full-time internship, which was 3 days a week. I was here in Philly at Temple Hospital, and I absolutely loved it, but I was just kind of like running myself ragged. I was taking like 5 classes, how it is, the grad school life. And I ended up starting with a new gynecologist. So I had been kind of, I'm a military, my dad was in the military. So we moved around my entire life, kind of settled in the Philly area in 2015. So I started seeing a new gynecologist in 2015. She, I said, I'm having these out of control periods. What can you do? So she decided to try the IUD. I had been on, at that point, 8 different birth control pills. I'd had side effects from all of them, so it wasn't really going so well. So she tried the IUD. It was one of the most painful experiences I have ever been through, to be honest. And I know everybody has a different response to that, but it was quite painful for me. So we started monitoring just the pain after that. And a few months later, she had me come in for an ultrasound, and it showed that I had a 3 centimeter cyst on my right ovary. So, I'd had PCOS, so I was used to seeing kind of the grapevine, they call it, the little cysts all over, but this was a bigger one. And she said, let's just keep monitoring. Let's see how it goes. And then a couple of months later, I was in really severe pain at that point. And she had me come in for another ultrasound, and it was 6 centimeters. So it was growing. And she said, I think we can wait. Let's just keep looking. And by the time, the third ultrasound came along, it was 9 centimeters. And I was like, it's like a size of a baseball at this point. So I was in pretty good pain, I would
That
say.
sounds huge.
I was not happy. We'll put it that way. I was pretty miserable at that point, but part of the problem, I'm sure you can relate to this, is being an athlete, you just are taught to fight through the pain. So you're like, okay,
Oh my God.
I've had,
Yes. Yes.
I'm sure you know.
100%. Oh my God. And side note, I recently went to my doctor and he was doing his just IC initial assessment. And he was poking around and he's like, does that hurt? Does that hurt? And I was like, well, it's not, it doesn't feel comfortable. And he's like, okay,
Right.
I get it. You were an athlete. You have a really high pain tolerance. Like that
Exactly.
explains a lot that's going on here. So yes, I can relate.
Yes. And it's like, it's just funny because I think back to this time and I was in such agony, but I was like, I have to keep working. And so at that time I was working in pediatric oncology, social work. So it was, I had a lot going on. It was a busy job. And I just remember kind of falling over in the hallway at one point. And I worked at a hospital. So the attending was like, you need to go have that checked out. So they sent me home. So I ended up going to my gynecologist and she said, well, yeah, she actually said to me, if I were you, I would not schedule surgery. I think we need to just wait. And I said, I don't think I can wait. Like I have a high pain threshold and I'm at like a 10 out of 10. And she said, all right. So we scheduled the surgery a few weeks later. So she went in to do like a diagnostic laparoscopy and kind of take care of the cyst. And when I woke up, she said, I had to take your ovary. You had ovarian torsion. And it was beyond repair. So
You had a what?
ovarian torsion. So it had actually, so the cyst was so big because we had waited, it had actually turned on itself and cut off the blood supply. So it was necrotic.
Okay.
And was completely, I guess, just like for lack of a better word, dead. So she went in and was like, I couldn't do anything. I had to take her fallopian tube to your ovary. So I was obviously very upset, rattled by that.
Yeah.
I had no idea it was going to happen. So that was tough.
Right. Well, and I'm sure it was really frustrating because you kept telling her like, I feel like something's going on here. And she was like, well, if that were me, if I were
Exactly.
you're
exactly.
not. Thank you.
I know. I'm like, the implication is like, well, I think you can handle it. And I was like, I really have a high pain threshold. Trust me.
Ugh.
But it's just so, yeah. And that's a whole other conversation about the medical gaslighting portion of this.
Right.
But the reason I bring up this story is that is unfortunately, the direct cause of my IC. I think what happened was, I was never the same after the oophorectomy when they removed the ovary. I can honestly say my pain was just, I kind of had pain. I've pretty much had it consistently since then. So that's about 7 years ago. So I don't exactly know what happened, but all of a sudden, about a month later, I started having this bizarre bladder pain. I was like, I've always had I would say a weak bladder. I used to urinate frequently. I had a cystoscopy done when I was like 18 or something because I was just peeing so often. And I was in college. I couldn't figure out what was going on. I did have a history of UTIs, but I had kind of been, hadn't had any symptoms for a while. And then this, the surgery happened, which I guess was like a trauma to the system. So I started having really bad bladder pain. So the kind of interesting thing about my history is my mom actually does have IC. So,
oh, wow.
Yeah. So I like to say that was a good thing for the most part, because I was kind of familiar with what that meant. I had heard of it. But her story was a little different because she had one hydrodistension and she pretty much has been symptom free for about 30 years. So
oh, wow. That's
she's
amazing.
very lucky. She also, with that said, she also had the Hunter's lesions, which I know only like 10% of patients have.
That's a whole different thing.
It's a whole different ballgame. Exactly. So that was when the IC, I guess, symptoms started. And yeah, we can get into all that. And since then, it's been an interesting time. But yeah, that's how that kind of happened. And yeah.
Okay. So you had that procedure, you started to get this bladder pain. So then what did the diagnostic process look like after that? Like, did you do treatment? Like, how did that look for you?
So, like I was saying about my mom, it was kind of good that I had that knowledge going into this, because I kept getting, I would go, I guess, to my primary doctor and I kept getting negative, no, I didn't have an infection. There was no UTI. So my doctor was like, I don't know what to tell you. And I said, I feel like I have a UTI. It just feels like that constant pressure, burning, like I have to pee constantly. I finish going to the bathroom and I have to immediately go again. And no one really could tell me, yes or no on that. And I was kind of talking to my mom here and there, and she said, it might be interstitial cystitis. If I were you, it's worth looking into like an elimination diet. So she kind of told me,
I love it.
Yes, I was very fortunate. Yes, because she was like, and she had her stuff back in like the 90s, before this was really ever talked about. So that was one really big benefit I had, is that I did know a lot about it coming into it. So she said, look, you need to stop eating and drinking like everything that tastes good, basically.
Right.
So the one thing, it's funny, I had listened to one of your other podcasts. I forget the girl's name, but she was talking about how she never gave up coffee. And I felt the exact same way. I was like, I don't care what I need to give up. I am not giving up coffee.
No, I was the same way. So I understand.
It was the one thing. I literally stopped, everything else, spices, how it is, caffeine, except for coffee, tomatoes.
Something clicked in my brain. I told you I had a headache, and today I didn't have any coffee, and I normally do. And I'm wondering, maybe that's it.
Oh my goodness. Yes.
I'm going through withdrawal.
Sorry
to interrupt you. I just
That's okay.
connected my own dots. And
that's okay.
That is a good thing and a bad thing.
Yes. I know that feeling. Yeah, it's a not fun feeling. So I hear you. It was something I did not want to live without. So I made it work. It's funny because I basically just went on a full 100% elimination diet at that point. So this is maybe a couple months after the surgery. And it was really hard. And I'm sure you've gone through this too, like explaining to my friends and my boyfriend at the time. They were just like, what's wrong with you? And I'm like, well, I can't really eat anything. I can't drink any, we would go out for drinks. And I was like, I don't want to touch alcohol. I'm not a huge drinker, but I do like wine, that kind of thing. And I was like, nope, I can't eat at restaurants because I don't know what they're putting in the food. So it kind of changed my life in a lot of ways, almost overnight, because it was very sudden how it all kind of happened. So I think my diagnosis was a little bit sped up in terms of, treatments and things because of my mom's history. So that worked out well for me. So with that knowledge, I kind of went into a urologist and I said, I think this is what's going on. I've had negative UTIs or, tests. I've tried antibiotics, nothing seems to be working. And I kind of explained. So they did the regular, I forget what it's called, where they check you in the office for like how much water or urine you're retaining.
Is it the urodynamics?
I think it is. Yeah. The urodynamics.
They have a couple different tests that they do, and I haven't had them done in years. So sometimes I forget.
I forget what it's called too, but they'll like have you drink and then they kind of measure how much, and then they have you void and check how much is left in the bladder.
That's the urodynamics.
I think you're right. So he did that and he was like, oh, you're fine. You're getting rid of most of the urine. And I was like, yeah, but I don't feel fine.
Great.
Yeah. I'm clearly thriving. Yeah. So he gave me, that was the first time I think I was given Urabel. That was when I tried Urabel, which was great for a little while. It did help me for a little bit. And then it kind of just stopped working. And so at that point, I kind of fell back to the Peridium, which I had been, on and off during I remember being a teenager and like, I was always that person that had to like find the bathroom. I could never be away too long from the bathroom. At soccer games, I was like running to the little porta potties all the time. So I kind of knew a little bit about Peridium and I just knew it in my head as, oh, it's that pill that helps me not pee all the time. So I was like, great. Because at that point I wasn't having bladder pain. It was just frequency. And so now, after the surgery, it was the pain. It was very painful urination. It was burning. It was, all of that. So I started kind of going back and forth between the Urabel and the Peridium. And of course, and I still don't really understand why doctors are so hesitant to prescribe it. I guess because you're not supposed to take it, for too long. Yeah,
the Peridium you're not supposed to take long term, but Urabel, it's my understanding that you can. So
okay.
I was also frustrated by that because Peridium was like the one thing that 100% helped me every single time. And
same.
Well, I can't take this every day. Well, that kind of sucks. So
right.
Yeah, I get it.
Agreed. I think it was Peridium actually since that point on has been my go-to, but I guess when this all first started, it wasn't really working. So that's why I had tried the Urabel, which, it did work for a little while. So then it was kind of a guessing game as to like, oh, well, if I try eating this, is it going to flare me? Or, just little by little, I would try to get more of my life back and normalcy. And it was difficult. It was a difficult time. So I guess at that point, I was referred to like several other urologists who kind of did the same thing. They're like, well, you seem to be okay, and you don't have a UTI. And I'm like, oh, I know that. But, it took a little while until I finally was referred to an IC specialist in Philly. And he was like, he met with me once and he's like, yeah, let's get you in for a hydrodistension. Let's try it. So fortunately, like I was saying, my mom had it done. So she kind of told me what it was, what to expect. So I went in for that. And the first one, I came out of it and he said, well, I didn't see any lesions. You're fine. Fairly dismissive. Like, well, you seem to be fine. And I was like, all right, I guess I'll, see what happens. So after the recovery from that, I actually did great for about a year. So I was pretty symptom free. I still have no idea how that happened, but I didn't really change much. It was just the hydrodistension, I guess, worked.
That's great.
It was great. It really was great. So, everything was going okay. But in the midst of all this, I had a couple other things going on. So I started having another cyst growing on my left ovary, which was the only one remaining. And so I was kind of freaked out about that. So I was kind of rushing to the emergency room every, so often because I was afraid of having the torsion again. I was trying to protect that ovary. So it was a constant like, oh, I better run and make sure this isn't happening. The torsion isn't happening because I'm really bad at gauging pain, at this point.
Well, yeah. And you're probably traumatized from what happened to you.
Right. It was definitely medical trauma. And, even going to the emergency room and you're trying to explain this to them and they're just like, well, a couple of times I think I'd had cysts that like small ones that might have burst because they were like, well, we see fluid, and a couple other times it was, just nothing, but it just felt like stuff was going on. And it's always kind of that guessing game. So I ended up having a 6 centimeter cyst finally on that left ovary. So I went into the ER and they actually, did an emergency surgery. And I think that's when the bladder stuff kind of was triggered again. So I really didn't put two and two together. I was just like, I just know I had surgery and now I was having increased bladder problems. So I was like, I work in the medical field, I have this history with my mom and I still wasn't really putting two and two together. Mm-hmm. So, it's a confusing process, I think, for everybody, but
yeah, I hard to keep track of everything that's happening to you.
It really is. But I think as medical professionals, you kind of hold yourself to like, well, I should know about this because I work in a hospital or, right. Or I've been counseling, patients about this kind of stuff. And why can't I figure it out for myself? That kind of thing. So I was like, well, I know, we'll see how it happens. So I came home from that surgery. And she had told me, she was like, I don't, the gynecologist, this is down at Penn. And she was the first doctor who said to me, we didn't see any endometriosis, but I think you have it based on your symptoms. So she was the first doctor I really would say actually listened to me the first time. And she was wonderful. So that was, maybe 5 gynecologists in and like 2 or 3 urologists at that point. And not to say they were all, rude to me or anything like that. They were just fairly dismissive because it's like, well, we didn't see anything, when we went in there. Or like the hydrodistension. Well, you didn't have any ulcers, but it was like, well, something's still clearly going on.
Right.
So that was great. So she kind of started me on a treatment protocol for my endometriosis. So this was kind of going on at the same time. The bladder stuff started up again. So at that point, we had tried all different, birth control options because she's like, we need to stop these cysts from growing. I don't know how, but whatever it takes. So we kind of started doing seasonique, I guess it's called, or seasonal, where you only get your period every 3 months. And that seemed to work for a little while. And then I started, like I was saying, I'm a big time athlete. So I started getting into CrossFit because I was like, all right, I have my ACL done. So I kind of gave up soccer for that, for the time being. So I was like, I got to do something. So I started working out at this CrossFit gym, which I got really into. And I was doing really heavy weightlifting. And again, wasn't thinking, just was like enjoying it and the, the competitive nature. I don't know what happened. I think it was a combination of events, but my bladder, I remember I woke up one morning and it was like, that was it. I was like, horrible flare. I felt like I had a UTI. I was doing all the things in my toolkit. I had my Peridium. I was drinking more water. I was, back on my diet, and nothing was working. So that's when I kind of started to panic,
Mm-hmm.
I'm sure So it was a couple weeks into the pain. You're like, oh my gosh, I can't get rid of this. This is scary, And of course, you're kind of, on your own, because most of the doctors you talk to don't know anything about it. So I had at that point moved out of Philly into another town. So I started up with a new urologist. So I called their office and I was like, I'm a new patient, but I'm in a really bad flare. Can you please fit me in? I don't care who it is and what time. So they fit me in like the next week. So I go in and I just started sobbing. I was like, I don't know what's wrong. I've been told I have IC, but I don't have the lesions. Is there anything you can do for me? And so the doctor was great. And he's like, let's talk about options here. So he wanted to start me on Elmaron, but I think that was the one that's like 600 or 800 or something like that, out of pocket. And I was like, that's really not quite an option for me, but is there anything else?
Before the lawsuit started happening, or was it like more recent?
No, this is 2019.
I don't know when those lawsuits started to happen with Elmaron, but I think that's when the insurance companies started being like, oh, we're not covering it anymore, because I was really looking into it. And my insurance was like, yeah, you're going to pay $900 per month for that. And I was like, nope, I'm not doing it.
Yeah, no, that was exactly what I said. I was like, there has to be something else to try. And so this is, I guess, 2019. It was like January of 2019. So I talked to them. I did, I guess, 3 different installations I tried. So that was, they make the cocktail, like the lidocaine and baclofen and whatever else. And they injected, then you wait for a couple of hours and hold it in. So that, and that was, in a way, I would say traumatic, because they're doing, they're cathing you in the office. So it's, for me, it was
traumatic, especially if you don't use a pediatric catheter.
Right. Which they did not. So, so it's crazy, because I'm like, and, at this point you're kind of in an office where people have at least heard of IC, or the providers have at least heard of it. They might not treat it too often, but they're like, okay, we're familiar with this. So, and the nurse was great. Like, she talked me through it and everything, but it's still, it's painful and not pleasant. So, so I tried that, I think 3 times, and that didn't do anything. So my bladder pain was still there. I was definitely still having a flare. In the meantime, I started doing acupuncture. I started doing Chinese herbal medicine to try to see if that could help me, because I was like, I don't know what medicine to take. Peridium wasn't really working at that point. So we decided, my urologist and I decided to do another hydrodistension. So this is 12 months almost to the day after my first hydrodistension, which is apparently not recommended, but I did not know this. So, because I think he was trying to help. He was like, I don't know what else to do for you, since everything else seems to be failing. If that worked for you, why don't we do it again? So I was like, all right. So they get me in. It ended up being with another urologist in the practice, female, which was great. I had never had a female urologist until then. And so we went in, we did the hydrodistension, and for whatever reason, my pain was like a 15 out of 10 after that. Like, it made my bladder pain so much worse. It did not have the same effect as the first time I had done it, which was, January of 2018. So I was pretty upset at that point. So I went in, I remember I went in for my follow-up appointment with this other urologist who had done the surgery. And she did an internal exam with her fingers, and she said, you know what? I actually don't think I think you have IC, but I don't think the problem is IC. I think you have something called pelvic floor dysfunction.
Okay.
And I just remember that was the first time I'd ever heard that term. So I was completely taken back. I'm like, what does that mean?
Right.
Like, what is that? So, and again, I had been dealing with this kind of weird, pain for a long time, and being an athlete and everything, but I had never been talked to about that by my provider. So she said, yeah, I'm going to refer you to pelvic floor physical therapy. So I went in, to a practice. I started doing pelvic floor PT, and they started giving me Kegels, which as we all know now.
Oh my God, Renata, your story is just a series of unfortunate events. Like
Oh, I know.
You
It's
poor
kind of a
thing.
comedy of errors, to be honest. You
Yeah.
have to laugh because it's kind of ridiculous, but
Mm-hmm.
and it's just interesting because, having been through it, and I'll tell you the rest of it in a minute here, but you kind of look back and think like it was a rough time, but you definitely learn a lot from it. So it's like, in a way it was good because you kind of, got to it eventually, but it took a while. But now I'm smarter for it, and I can help, hopefully help others. But so they were, it was a new PT who had just started, she's like, let's try Kegels. I was like, this is making me have a lot of pain. Can we not do this? And then they did the internal, I guess the internal stim, I forgot what they call it, machine where they do the whole, biofeedback and things like that. And she was like, wow, you're off the charts with your, like your, the hypertonic part of this. So I was like, I was just like, yeah, I'm in a ton of pain here. Makes sense. So that was the kind of the first time I had heard that, the term hypertonic pelvic floor dysfunction. So I ended up at that point, I was just not doing well at all. I started working. I had a new job where I got to work remotely, where I'm still currently at the job, which is great. I love it. And I get to work from home, which makes things so much easier for all this.
Yes. Oh, I can relate to that. It's fantastic. You can wear your pajamas all day.
Exactly. I can wear my PJs. I can run to the bathroom as frequently as I have to go. I'm not, as much as I loved working in the hospital setting, it was getting to be a lot with my trips to the bathroom and, being on your feet.
Same. Oh, being on your feet all day is just rough. And then when COVID hit, having the mask on, the N95, I was sweating. And then that would trigger me to clench my pelvic floor. And then I would have pain and I'd be like, oh, this is horrible. So that actually led me to start my own business. Side note.
That's awesome.
Greatest thing I ever did was find a job that lets me work from home. So
I agree with you. I'm happy for you. I can relate 100%. It was one of the biggest things that helped me for sure. Because I stopped having to deal with, the commute and the running around and on my feet and everything. So that was great. So I started working from home and I actually, which was pretty hard for me because I'm a fairly independent person. I actually moved in with my parents because I was just doing so poorly. And I was at the point where I couldn't really sit. I couldn't lay down. I couldn't get comfortable. It was like my bladder, but my pelvis was everything just hurt tremendously. And I kept having, this is when the pandemic started. So, I had telehealth visits with my gynecologist, who was wonderful. She really was great. But she's like, I don't know what to tell you. Like, obviously you're having a lot of issues. And I was in PT, but it was kind of not going great. So she said, it seems like nothing we're doing is working. So I think your options at this point are hysterectomy or try to get pregnant because we got to take this stuff out.
Oh my God. Those are two not great options.
Great. So, I appreciated her candor. And she was just, a straight shooter like she is, but I was like, so I'm single at that point. I'm not married. So, kids was not something I was thinking about at that time. And certainly neither was a hysterectomy, obviously last ditch effort kind of thing. So,
and how old were you at this time?
33.
Okay.
So this is about 2 years ago.
Okay. Got it. So then what happened?
So I guess at that point we made the joint decision that this is during the pandemic again. So she said, as soon as the OR opens up again, I think we need to get you in there. Cause obviously, at this point I was explaining my pain to her and I said, at this point, the birth control I was taking didn't seem to be working. I was having pain pretty consistently all day long and at night. And I was bleeding, when I wasn't supposed to be, and I was spotting every day. And I was like, I don't know what's happening. I feel like my body was just kind of in chaos, and my bladder was bad and everything. So she took me off the Seasonique and said, we need to wait, let's just schedule the hysterectomy. I think at this point, there's not much else we can do. And jokingly, she's like, you could try to get pregnant, but to be honest with you, I'm not sure you can anyway. So, so I was like, all right, well, I guess we've made our decision. So,
oh my gosh. Wow. That had to really mess with you in the head.
It did. I can tell you that. My poor parents can attest to that. I was living at home. It's the pandemic. We're all scared,
Mm-hmm.
anxious. I'm not seeing my friends, my girlfriends. We're all talking on the phone. But and it's a challenge because I'm at an age where all my girlfriends are having kids, and for the most part, they're getting married and having kids, and it was just a little hard because my two best friends were at that time were having kids. And I was like, well, hey guys, I'm actually having a hysterectomy next month, so it was it was a bit of a challenge for me, I'd say psychologically. And just
Mm-hmm.
the isolation of, well, first of all, the isolation of going through a hysterectomy at a younger age, but also during a pandemic where, ultimately I ended up having to do it alone. Like I couldn't have any visitors or anything. So that was another piece
Oh
to it, which we
boy.
can talk about. Yeah, it was
Yeah.
kind of
Why don't we take a quick pee break and
sure.
then when we come back, you can tell me more about that. Does that sound good?
Perfect. Sounds good.
All right, we are back. So Renata, tell me all about this hysterectomy that you had.
Okay. So I decided with my GYN, we made the decision to go ahead with the hysterectomy. So of course, with the COVID, the pandemic it was towards the beginning of 2020. So the OR was booked out, because everything had been delayed and they had just opened it up again. So by the time I had made the decision in my, I guess, pre-op appointment, there was a 6 week wait. And so I was pretty anxious. It was just, everything, the pandemic, being away from friends and not able to really talk about it. Just feelings of isolation and a lot of anxiety, which was just, my poor parents were wonderful and really supportive of me because I was living at home at the time.
It's great that you
And
had them,
I
honestly.
really am so fortunate. Yeah, I have a great network. So I was at home and I have a brother who's also very helpful. So they were my emotional support system at that point. I am, of course, my girlfriends who I would, we would check in on, like Zoom or whatever, FaceTime and stuff.
Right.
So, but it's just really hard. And I'll get into that in a second. It's hard to talk about something that, like my girlfriends can't really talk to me about this stuff because they haven't gone through it. So it's like, I can talk to their moms maybe, but it's like, it's hard to
Right.
talk about that. So, but I can get into that in a minute here. So yeah, so we made the decision. So we went down, it was at Penn. I'll never forget my mom hugging me, before I went in and she had to leave me there. And it was just kind of a crazy moment because I'm like, I'm going to leave this hospital a different person for sure. So it was a difficult, definitely a difficult moment, but, yeah, the story gets even crazier. So I went in.
Right.
Yeah, I know, as if it already weren't enough. But it's like I said, comedy of errors. You got to laugh. But yeah, so I went in for the surgery. I had talked to her all about. She knew about the IC. She was wonderfully, my doctor, super supportive. She was like, "Okay, we have a pediatric cath for you." Unfortunately, I said to them, "Is there any way you can do this without a catheter?" And she said, "There's no way around it. We're going to be going right around your ureters. We have to check that we didn't perforate your bladder." So I was like, "All right." I almost said to her, "I'd rather just take my chances," but because I'm like, at this point, cathing is so traumatic for me. So she's like, "I'm so sorry." So she gets me a pediatric cath, which is great. So I wake up from the surgery and totally a side note, I'd had an allergic reaction to the propofol. So they gave me Benadryl. So I'm like, I'm super drugged. So I wake up and I was just so out of it. So she's like, talking to me. I think she had to repeat herself like 5 times. I was like, I'm not comprehending. So I come out of recovery and I'm, my room and everything. So I'm starting to get, back to normal. And I remember feeling my bladder and I was like, that's weird. Everything is numb for the most part. And I was like, oh, I really have to pee, So, that's kind of that's a normal reaction for me with anything that goes
Yeah.
on. I think I store my stress in my bladder. So
Oh my gosh. No, I can relate to that. I had two different procedures, one being the hydrodistension and one being a vestibulectomy. And both times I came out of anesthesia, had to pee worse than I have ever had to pee in my life.
Yes.
So I can relate. That is not a fun feeling.
No, it's not.
And then they're like, "Oh, hold on, let me get you the bedpan." I'm like,
"Oh, I love
I'm
that."
supposed to pee in that?
You're supposed to hoist yourself up with your arm,
Right.
get it under, and all on your own, and then somehow maneuver. Yeah, it's kind of an art. It's a form of art at this point.
I know.
But Yeah, so that was exactly my thing. Well, I was cast, so at this time, actually, that wasn't the thing. But so they were like, well, I kept saying to the nurse, I really have to pee, and she's like, well, just pee, like you're catheterized. And I was like, I know, but I can't. Like it feels like I can't. So she's like, okay, I don't know, I don't know what to tell you. And I was like, I called her in for like the third or fourth time. And I said, if you don't take this catheter out, I'm going to rip it out myself. And I'm like, clearly I'm drugged. I'm not thinking straight. And I'm like, I so much pain. And she's like, we're giving you so many pain pills. I don't know what to tell you. Like, and I said, I need Peridium. I don't know. So I'm like, I'm feeling all this bladder pain. So this is just another ridiculous story. So as it turns out, the catheter had gotten stuck on my leg, had kinked, so it wasn't draining. So the tube. So my catheter backed up to 1,000 cc's. I am not exaggerating.
Wow. So. Wait, how much is that in ounces? Do you know?
I don't know. All I know is I was told I was told that the normal bladder holds 200 cc's. So
Google search. I know I have Canadian clients and I always have to do this conversion.
Oh, that's interesting.
33.8. Whoa. That is so
impressive.
Liquid. Wow.
I'll never forget when she actually figured out what was wrong. And she could not have been more apologetic. I mean, they called in the attending gynecologist and he's like, I don't know what's going on. Like, and she actually pulled up my blanket and she was like, oh my gosh, it's stuck on your leg. So I was like, so after all of that, my GYN and I had exhaustively discussed, like, I said to her, it's like, it's ridiculous, but I'm having a hysterectomy, but my number one concern is my bladder. I said this to her. I was like, I'm so concerned about having a problem with my bladder because I've been dealing with bladder pain. This flare up was lasting a long time. And she's like, don't worry, we got you, So it was just kind of ironic how that happened. So I started going, so I come home from that and I was in pretty severe bladder pain. So that was, little did I know, it wasn't just the issue with the catheter, but I guess they now have said that it was the pelvic floor dysfunction that was just traumatized by the hysterectomy, like more so than it already had been from the weightlifting and whatever else the other surgeries I'd had. So I had a total laparoscopic hysterectomy. So fortunately it was all through the abdomen. But I did have, everything removed. So I actually opted to have, I didn't really have a choice, but I had my ovary removed because I was like, that was the main issue was all the cysts I was having. So they removed the ovary. Actually, I had my cervix as well because I did a lot of research beforehand about that. And they said a lot of women regretted not having their cervix out because, eventually down the road they might want to. And then it's like you have to have another surgery.
I didn't know that was a thing that people even got their cervix out.
Yeah. My GYN and I talked about it quite a bit and she was like, it's your decision, but I know a lot of women will come back later on if, saying that they want to have it out. There's always the risk of like cervical cancer, those kinds of things. So,
okay.
So I have a history, family history of some cancer. So I've always been a little wary of that. So I actually opted to have it all taken out. So, which meant I went into immediate surgical menopause, which was fun.
So tell me more about that because I'm very unfamiliar with surgical menopause.
As was I. So I will tell you, and that's something I wanted to bring up here because it does tie into the IC a little bit. Because I guess for me, especially, and I'm sure for other women out there, it's hard to differentiate what's going on with what, because you're, a lot of times like the pelvic floor dysfunction manifests as bladder pain in my case, but I also additionally have the IC. So it's like trying to figure out what the specific pain is. So at any rate, surgical menopause. So, my GYN, who I did like a lot, she was very helpful. She said to me, you're not going to need to see me anymore, now that we're she treats endometriosis and that kind of thing. And she did tell me, which I forgot to mention, when she got in there, she said I had really severe adenomyosis. So that's like, I guess the endometrial tissue. You can correct me if I'm wrong. The tissue gets trapped in the lining of the uterus. I think that's the definition anyway. Or something is trapped. I'm not the person to ask for this, so hopefully I'm not either. If we're wrong, somebody will tell us after the fact. So. I know, and it's like the definition of endometriosis. I know they always say it's like the endometrial like tissue. It's not technically the tissue. So I'm not sure the technical definition of adenomyosis, but I had that. So my uterus was actually, she described it as black instead of being like pink. And she said that I had pelvic congestion syndrome. So that's basically like varicose veins in the pelvis. So everything was, she said, was engorged and kind of inflamed, which is kind of fun because, not funny, not the right word, but ironic because, she was like, it's something I don't usually see in like kind of petite, younger women. It's usually if you've had multiple you've given birth multiple times, you're maybe older in age, those kinds of things. And she was like, I was very surprised by that. So I didn't really know what that meant. I just was like, okay. So she said, the only thing she really said to me was, you're going to have hot flashes and you're going to gain 15 pounds. So that was kind of that discussion.
More good news.
I know. And I was like, okay. So I'm literally, at this point, I'm outreaching to my best friend's mother, who's, in her 50s. I was like, hey, so you're the only person I know who's gone through menopause. Can you talk to me about this? So that was fun. So she kind of gave me some pointers, but because of my family history with cancer, I was very hesitant to start, hormone replacement therapy, which I know there's a lot of, it's controversial because I know there's studies saying there's no link to cancer, but I think, I'm just very wary of that. So for me personally, it was, my decision was not to do HRT, which did mean that my symptoms were a lot more, strong, pronounced. So I had really bad hot flashes. I had, not to get into all of it, but, you have a lot of dryness and those kinds of things. And I do think that can impact the bladder as well, because there's something called like genital urinary symptom, something like disease of menopause. I forget the name of it exactly, but I think that could have been contributing. So all I know is, my bladder was kind of very angry with me, we'll put it that way, for a good, I would say 9 months, no exaggeration. So what I ended up doing at that point was I was going to acupuncture at least once a week, I think. And she was just treating my bladder pain. I was like, I don't even know what's going on anymore. My bladder is, and she was very concerned because of the catheter incident. So she's like, your bladder almost ruptured, so you're going to have a lot of pain for a while, but she was working on that. In the meantime, I started going to another pelvic floor physical therapist who was recommended by a family friend who's a PT. And he's like, go to this woman. She's the best. And Erin, I know you're listening to this somewhere. You're going to be listening. You are amazing. Shout out to Erin Donahue. She's amazing. So she's actually at the restoration space, which I know is where.
Oh my God.
Yes. Isn't that funny?
Wow. Comes full circle. Back to Dr. E from episode 6.
Yes.
Wow.
Over in Bethlehem, PA. Yep. So she's over there now. She was at St. Luke's when I started seeing her. So I think I went into her about 2 weeks after my hysterectomy, and I was pretty much just a, emotional mess. Menopause, I've never had such mood swings. I was, depressed. I was anxious. I was, feeling everything. So she started with me, and I, like, no exaggeration, I could barely sit. I was in so much pain, like pelvic pain, bladder pain, everything. And I was like, there was a moment where I was just frustrated because I was like, I came all this way and I made this really hard decision, about the hysterectomy, and I'm actually not doing any better. Like, I just replaced all the, like menopause or the period issues that I was having, like endometriosis and all that, with, pelvic pain or whatever's going on. So it was a few months of that where I was just like, why am I not getting better? And, as an athlete, you're like, I'm putting in this work. Why am I not seeing results? That mindset. Mm-hmm. So anyway, I was working with Erin, and she was like, I think she, at first we were starting with just breathing and that kind of stuff. I'm sure you've been through the PT stuff. So it's, and it's also, for me, it was a little bit re-traumatizing in the sense that it was like, I had been through so many different abdominal surgeries and pelvic stuff that I was like, it's very intimate, and, it's very, it can feel a little violating at times because it's just so personal. And there's nothing you can do about it because that's just the only way around it. And so you're like, all right, I have to do this. And it's not violating in the sense that it's like, scary. It's just, if you've been through stuff, it can be a little upsetting, at times. And so that was my experience with it. It was painful. And it was like, I don't really want someone in that area, unless it's absolutely necessary. So going through months of that feeling and not, I wasn't really improving all that much. And I was just like, putting myself through these, I remember coming home from treatments, and I mean, Erin's wonderful. It's nothing against her. It was just my mindset, and I would be crying, and I was, just kind of distraught. Like, why am I not better? And, she was having me do the dilator therapy, which is like the different sizes that you're trying to kind of get the tissue,
right,
internally to relax. And I couldn't get that to work. And it was just a lot of frustrating moments, and, with all the medical trauma, if you will. So I was kind of in a rough place, and Erin can speak to this because she was, she was my unofficial therapist for a while there. Cause I would just come in and just, I was just dealing with so many different things. And
I think a lot of pelvic floor PTs do that, just like Erin. I think they double as unofficial therapists because we all go through a lot mentally and,
oh yeah,
with our relationships, it's difficult. So yeah, we got to blow off some steam sometimes.
absolutely. Absolutely. And it's nice to talk to people who also are familiar with this stuff, and it's not starting from scratch, because my girlfriends, of course, they've been wonderful and super supportive, and they have their share of health issues, but it's hard to talk about this kind of stuff with people who might not have gone through it or know exactly what you're talking about. So it was nice to have Erin as that support. She actually got me in touch with a mental health therapist who I did start seeing via Zoom, who was absolutely wonderful. She's actually since left the practice, unfortunately, but she was really wonderful. She specialized in pelvic pain and trauma. So that was great.
That's fantastic.
She was unbelievably good. Yeah, I was so happy I had her. So between her and Erin, I was making psychological progress, of course, but I wasn't making a lot of physical progress. And again, it was nothing that Erin was doing. She was great. We were making minimal progress, just not where I wanted to be. And I was still at the point where I was, I was still living at my parents and everything. And I was unable to use my abdominal muscles. And we're talking like maybe 4 or 5, 6 months post-op, after the hysterectomy. And I'm still, urinating. Erin had me start a like, I forget what she calls it, like a schedule. You write down how many times you urinate during the day, and I was going
like a log.
A log. Yeah, I was going like 20 to 22 times a day. So we were trying to minimize that and figure out triggers and stuff like that. So so the IC kind of took a back shelf here for a minute, because I was so focused on just recovering from the hysterectomy and the pelvic pain I was dealing with. So at that point, I was still having a hard time sitting, and like standing, or, even sitting at my desk at work was painful. So I had now switched to a different gynecologist who dealt more with like menopausal stuff, and, more than the endometriosis and all that. So I guess at that point was when Erin and I were talking, and she said, I think you're at the point where you might need to consider pelvic floor Botox, because you're not making progress in physical therapy the way that you should be. And I was like, what does that mean? So there begins that. So, so what ended up, they've actually since, and of course at the time I didn't know this, but they've since said that they think it's pudendal neuralgia that I have, or pudendal nerve entrapment, but that they're not sure which one. So so at this point is when I started with a new gynecologist down at Penn. She's amazing, Dr. Elizabeth Banks. If anybody's in the Philly area, she's awesome. So she and I met as another doctor. She sat the first time. Our intake session was an hour and 15 minutes, and she just she went into every detail. She's like, you need to tell me every symptom, how long this happened. Did you have any pelvic, trauma as a kid? And I'm like, well, as a soccer player, like, I'm sure I fell and hit my tailbone, and I just don't remember, that kind of thing. So we started all the way at the beginning. And she's like, yeah, I think you're going to need a series of these, Botox treatments. So I was like, I don't even know what that means. So I'm like doing research.
Right. There are so many people who don't know what that means. And luckily I just educated everybody on it a couple episodes ago.
Yes.
So
yes.
don't worry about explaining it. I just had it done 2 weeks ago. So still working through that, but I want to hear your experience about it.
Yeah. So, and I did listen. It was great that you had that up. And again, this podcast is so great for so many reasons, but it's great to shed some light on this stuff that's so under discussed. And, it really is so kind of taboo to talk about these things in public. So it's a great platform. So thank you. But
Thank you.
so the pelvic floor Botox, yeah. So my experience with it, and I will say Dr. Banks's approach, at least with me, I'm not sure if she does this with all her patients, it was a little aggressive. So I think because I was pretty unable to function normally. And this is about almost, I would say 9 months after the hysterectomy. So is when we started. So she had me she does 50 injections. This is done in the OR. I was like, thank God, because 50 does not sound fun. So she does that in the OR. And at the same time, she does nerve blocks. So we do 2 in the pudendal nerve, I guess, 2 in the perineal. So like 2 inside, 2 outside. And then I have a lot of lower abdominal pain. So I was not able to engage my core, which is, as an athlete, was kind of tough for me because I was able to work out during this time too, which is one of my big stress relievers. So she did, I think, 10, abdominal blocks. So I came out of the first Botox treatment procedure in the OR and everything. I came home and I was in pretty horrible pain, I would say. I had pain medication and everything, but it was about 5 weeks of pretty severe pain. It was strange pain though, because it wasn't the one that I was used to. It wasn't like stabbing, abdominal pain. It was kind of like referred pain. So I would have lower back, really bad back pain and stuff like that. Or I had pain going down my legs, like, tingling and numbness and pain. So about 5 weeks, we kept having our telehealth visits and she was like, stay strong, stay strong. It's going to get worse before it gets better. And she was 100% right. So it was almost to the day, 5 weeks later is when I suddenly was like, oh my gosh, I'm not in pain. And oh my gosh, I can move and I can sit and, wow, I can lift this, jug of milk or whatever, So it started to work and I am just like, I don't want to say it, jinx myself, but it has been going so well. It has been super successful for me. So after that, so we do every 6 weeks, I do nerve blocks. And so the ones that are not in the OR, because she'll do when it's the time for Botox, she does everything at once, which is kind of nice because it minimizes, everything when you're awake. So every 6 weeks between there, we'll do in the office nerve blocks. So she'll just do everything except for the Botox, which was, I'm sure, I think you said yours was outpatient as well. So yeah. I think, it's not a pleasant experience, but it's definitely not. And I always feel like such a wimp for saying that, but I'm like, I'd rather be in the OR for this, I think.
Oh,
but
yeah, me too.
Yeah. Cause like coming out of even just, having the physical therapy was kind of difficult. Like, it was difficult for her to get started with that, just, using her finger. Well, not to get into all of it, but that was challenging. And then let alone, everything else that they were doing now. So I was like, I would rather just be in the OR, but it ended up, I think the first nerve block was pretty, in the office was kind of rough, but so that, at this point, I just had my Botox done a couple weeks ago. I think I actually might have had it on the same day you did, because I remember you were posting about it. And I was like, I just got home from the hospital.
Oh my God, samesies.
That's so funny. So I was actually, it's crazy. I just bought a house and I was painting my house 2 days later. I am not kidding. Like, I probably is not advisable, but I was like, hey, you know what? I was feeling good. I was able to use my core, I wasn't having really many side effects. And I think my body's just become attuned to it at this point. So that's great. So I am definitely a success story in terms of the Botox and the pelvic floor therapy. But I guess to bring it back to the IC, my bladder pain has gotten significantly better. Like,
good.
I do think that I was the pelvic floor subtype, I guess, I know there's different types of IC. I do think that was the big trigger for me. So now that we're addressing that, I can kind of, I have the space to deal with the bladder stuff. So it's like, okay, I can afford to kind of try more foods now. I'm not in that kind of heightened state of pain all the time. And, your nervous system is I guess they say it's upregulated. So you're just constantly tensing and, everything is a trigger for you. So I also will say I started with a neurologist up here at Lehigh Valley, who's wonderful. He's been super helpful too. So he's got me on amitriptyline, which has been really helpful for me. I know it's not for everybody, but I'm fortunate that it is working for me. So I think that's helping to kind of, desensitize my nervous system to a certain extent to allow me to function better and do more things. And so he's got me on that. He's got me on a treatment protocol to prevent UTIs. So it's something called methenamine, I believe it's called, Hiprex, I think. Okay. So I take that as needed. I also take vaginal Valium suppositories. That's from my gynecologist. So we do that 2 or 3 times a day, depending. And those are wonderful. They help me a lot too. Trying to think what else. I've got a couple other things. Of course, the Peridium, which is still in my toolkit. I always have it with me everywhere I go. Always in my purse. So that's kind of where that ties in. And yeah, so that's kind of how it all came together.
That's your story. I'm so glad that it had a happy ending and that you're doing well, because you were faced with a lot of obstacles. So man, you have to be a strong person to get through all of that and want to come on this podcast and talk about it. I think that's so awesome. I really do.
Thank you.
So yeah, that's great. And, I wish we had more time to, talk more about your career and all that good stuff. But I think just you sharing your story is fantastic enough. I think talking about the PCOS, the hysterectomy, the IC, obviously, the endometriosis, all of that stuff. Yeah. I think it's going to help a lot of people. So I
appreciate that.
Yeah. Is there anything else that you wanted to add to anyone, or maybe is there anything you want to say to somebody who's going through a similar situation?
That's what I was about to say, actually. As a social worker, I'm always trying to think about how can we support others and how can we be there for people who, not only is this stuff still, like I was saying, it's just so taboo to talk about it openly. It's not something you're going to get up on, Facebook or Instagram and post about. It's just so personal. It's private. And I do think that, I'm an extremely private person in my life. And it did take a lot for me to come out and talk about this stuff, because I really have not told a lot of people, what I've been facing the past few years. A lot of my friends are just like, okay, you kind of fell off the face of the earth. We haven't heard from you. So I do think that this is kind of my growth story, I guess, if you will. And I wanted, and I told some of my friends and my family members I was going to go on a podcast to talk about this stuff. And they were like, I'm so glad you're going to do this, because I just know that, when you say interstitial cystitis, most people have never heard of it, the common person, unless you're medical or have gone through it. So I think, and a lot of these other things, most people don't really know what that means, or endometriosis or whatever the case. So I think that just talking about it more openly is what we need to be doing. I think that the only way we're going to, spread awareness and education is by talking about it. And I think your podcast really, really helps with that, because there's really nothing else out there on this stuff, to be honest. And I do think for anyone else, going through anything that we've talked about today, it's just, I think reaching out to those around you who you feel supported by, whether maybe it's a support group or a group of friends, or, your friend's mother, whatever, you reach out to those that you need. And I think that, everybody has a different process. I know for me, I'm almost at the 2-year mark after the hysterectomy. I'm just kind of starting to talk more about it openly, and to be okay with, seeing like pregnancy announcements. And I'm not as upset by that now. And, I'm kind of becoming more, I guess, okay with this narrative, that this is what's going on, and I'm okay with it. And I'm happy. And as difficult as it has been, I wouldn't change it, because it's, it's made me who I am now. And if I can turn that around and spread, and I guess awareness or whatever information out there to others, then that's what I'm going to do. So
Yes.
that's that.
Awesome. So if anybody's listening to this and wants to reach out to you, are you okay with that?
Absolutely.
And
Yep.
how
I
can they
welcome
reach
that.
you?
I am on Facebook, Renata See. You can definitely like add me or message. I'm on Instagram as Rennie, I think underscore SI.
I'll link it all in the show
Yeah. Okay.
notes, so don't worry about the
Yeah. Feel free
spelling
to
it
reach
out.
out to
But
me. Absolutely. I'm happy to, I think as someone who kind of, I'm definitely on the introverted side. It's hard for me to talk about stuff, sometimes online is easier. So,
mhm.
I kind of wish I had been a little bit more open to getting on like a different forum or, support group and exploring that. I have since gotten more involved with that stuff, but at first it was really hard for me. So if anyone out there is, listening and wants to reach out, I definitely welcome that. And I'd love to be able to help if I can.
Okay, perfect. Well, thank you again for coming on. I think this has been awesome.
Thank you so much, Callie. Thanks for having me.